And again, welcome and thank you for being here for our virtual road tour stop in Missouri. And we can head to our next slide. We're going to be talking about veteran oral health in Missouri today. So our agenda, we're going to give a quick introduction and go into a little more information specific to Missouri. We're going to have a discussion. Our purpose here today is to really hear from the local folks in Missouri. We want to hear your reactions to the data we're sharing today, the details we're sharing about your state and what you're seeing on the ground. And then we'll talk about next steps and things to do with the data we talk about. You can head to the next slide. A little bit of housekeeping. We're recording this session. Again, this is very interactive. We'll have a few different prompts here of polling, things to put in the chat, different discussion topics. We want folks to come off mute and share, but we ask that you stay muted during the presentation and when you're not chiming in to share something. Again, in addition to the recording, we'll post slides and other materials to our website and email those out as well. Please give a warm welcome to yourself and chime in the chat. Type your email, your organization, and say hello. If you're having any technical issues like we just were having, please put that in the chat as well, and our staff will help you out. Go to the next slide. So these are our learning objectives. We have CEUs available for this session today. We'll give more information about that at the end of the call, but we'll post these learning objectives in the chat to you. These are tied to the CEUs and we're also available with registration. We can head to the next slide. Our speakers do not have any disclosures today. Our hosts, myself, Elizabeth Flannery, as I said, I'm the Director of Education and Leadership, and unfortunately, you're going to hear my voice a little extra today because Sam was unable to get those slides up on her side, but Sam here is our facilitator. She'll be facilitating our discussion at the end of the presentation. She's our Community Education and Outreach Coordinator here at AIDPH. We want to say a big thank you to Melissa, who helped us coordinate this and got the information out to all of you, as well as a thank you to Missouri Coalition for Oral Health in general for kind of taking up this cause and making sure that their stakeholders were part of hearing this information. I want to pause for a minute and hand it over to Carrie Harbison, the CEO, Executive Director, and for him to give a welcome to all of you today.
Thanks, Liz. It's my pleasure to welcome you all here. The Missouri Coalition for Oral Health is a nonprofit advocacy agency, and much of what we do is about increasing access to oral health care for everyone in Missouri. We've had long-standing interest in veteran oral health, and we were very pleased when we saw that AIDPH had pulled some data together, because we have not found a wealth of data before now. So we're looking forward to figuring out better ways to help Missouri veterans access care. So thank you so much for doing this, and for everyone for being here.
Thank you so much, Gary, for that context, and again for the commitment to this issue. We can head to the next slide. So I'm going to get us started here in a little bit of a minute, diving into the data we've been talking about and what we know about veteran oral health in general and veteran oral health in Missouri. But we want to start off with a poll that Sam's going to launch for us here. And we want to hear from you about what the top priority areas are for veteran oral health in your state. Again, part of us doing these tours to the states with the resources that we've developed at the state level is we want to hear from folks what's working, what they think about the data, but also what additional resources are helpful. So we can look at the data that we have gathered, the analysis we've done, and say, what are our next steps? What is most useful to the folks doing the work at the local level that will really help them out? So this will give us good information as we chat today and go into specifics, so we can tailor that, but also in general, the work that we do at AIDPH, we can stay at a good direction based on what's useful to the community. We can head to the next slide. Okay, so I'm going to give us an introduction. I see that there's still a fair amount of folks who are responding, so we'll give a few more minutes and then we'll come back to these priority areas and share out what that looks like. So we can head to the next slide. I'm going to talk a little bit about AIDPH and what our mission and vision is so you understand who we are and kind of how we got to this place of working on this data and in this space. Our mission is to empower our community to advance oral health through science, education, and advocacy. We're really at the intersection of those three pieces here today. Our research and impact team did a lot of analysis and work alongside our communications team to pull these state-based profiles together and get them published in a really usable way. And we have put together this road tour as an educational program so that folks can use this data, really understand it, and use it in a variety of ways to include advocacy. And we're doing this work because our vision is a justice-oriented oral health system. We can head to the next slide. At AIDPH, we have 4 communities of focus. That includes veterans, people in rural communities, LGBTQIA+ people, and people with disabilities, with a recognition, of course, that there is intersection among these communities and groups as well. Particularly when we're talking about veterans, we'll hear about that a little bit more as we dive into the data, that there's a strong coalition between rurality and veterans. And then, of course, those other communities as well. These are our communities of focus because they have been historically excluded, underserved, marginalized, particularly when it comes to oral health access. We can head to the next slide. And we just want to take a minute and say thank you to our funder. CareQuest Institute of Oral Health is making it possible for us to have done this work and for us to be here sharing this information as well. We can go to the next slide. I'll just share a little bit more about kind of the timeline and the work that we've done with CareQuest over the years. So since 2021, we've been working on collecting data, publishing data, and producing resources for organizations like yours and other states to be able to leverage the work that they're already doing into even more success, to create a more evidence-based framework for the work that we're all doing collaboratively to advance veteran oral health. So this is kind of a timeline of the work that we've done in the research, and we'll touch upon the state profiles, but again, some additional resource pieces when we're looking at that national overview of the research we've done in partnership with CareQuest Institute. We can head to the next slide. Sam, this is perfect timing. Are you ready to share our results?
Yeah, we've got about 78% participation, so I think we're there. I'll go ahead and share the results. Looks like 82% is access to care, and coming in second is integration with general healthcare. And I just want to make sure, can everybody hear Liz okay? We had one message in the chat that you were a little bit more quiet, but I've only heard from one, so let us know if you're having a hard time hearing Liz.
Okay, I see it just barely. I see some thumbs up. So I will really project. I'll pull my, you'll be a little closer to my face. I'll pull my computer closer. And just keep me updated. I'm always happy to be introduced if anyone's having a hard time. So interrupted. Okay, thank you. And thank you for sharing your thoughts on what you're looking at. I think, as I said, we're going to really dive into these pieces. And I'm actually, Sam, if I'm just gonna click a few buttons and see if it changes my audio for folks who it might be a little quieter for. Can you still hear me now? I don't know if that's any better. I'll try that and see if it shifts anything. Okay, so we're gonna get started here. We can go to the next slide, Sarah, if that's okay. And we're really going to start at the national overview. And we're starting with the national overview, which may be review for some of the folks here who are in this work and already working with this population. But what we've found in doing this work, we do a lot of work in veteran oral health and really find that it's actually pretty surprising where we are at a national overview for folks. A lot of people don't understand what the actual access is to dental care for veterans, and frankly, to include veterans themselves. It can be hard for veterans to understand the eligibility process and what's available to them through the VA. So that's where we like to start, so we all have an understanding of the current available benefits to veterans through the VA. And when we're saying those benefits, what we mean is what care veterans can get, how much it costs them, where they're able to receive that care, and that's determined by Congress. So that is ruled through Title 38, where eligibility for medical, dental, and other primary care benefits are all determined through federal code. And that can only be changed with a vote in Congress. And we also like to note that if a change was made with a vote through Congress, that in addition to changing that legislation, along with that, there'd need to be budget funding to be able to expand those access. So whatever change was made, the funding would need to be there to be able to implement that. So just starting with an understanding that a change to the federal healthcare system as it relates to the VA requires federal legislative action. And then we'll take a look at this slide, which is saying that most veterans aren't eligible for dental care, unfortunately. So currently, if you look at this graphic here, the top row of people represents about the 20 million veterans that are currently living in the United States, and the lightest half of them are the half that receives care outside of the VA or are otherwise ineligible for care through the VA. So as we move along this graphic to the left, the darker blue folks represent the almost 10 million veterans that are getting care in the VA currently. And so of that 9 to 10 million veterans, just a tiny, tiny little blue and red area represents a number of veterans who are eligible for dental care. And what that translates to is that veterans are going to the VA for health care, maybe getting their medical appointments, primary health care needs met, but if they have dental pain and dental conditions, they cannot have them corrected while they're already getting that other care there. So again, looking at this, about 1.5 million that are eligible, we see that a very small percentage, only about a third, are actually utilizing that dental care. So we don't really know exactly why the utilization rate is so low of the very small amount that are eligible, but we know that it can be something such as barriers to accessing like transportation, long wait times. Again, that understanding of eligibility, it could be that they're getting care somewhere else, but that's definitely a data spot where we need more information. We can head to the next slide. And so we're going to take a look at chronic disease in veterans. Veterans in particular with heart disease and diabetes experience a higher rate of dental issues. And unfortunately, what we also see is that veterans with those high risk, high cost conditions are more likely to lose all of their permanent teeth, even if they're experiencing dental visits within the past year. So again, even among those veterans who are accessing dental care and are able to visit a dentist, they're still receiving some of the worst oral health outcomes. And that can tie into chronic disease conditions not really being managed in an integrated care environment. And we know that the VA is the largest integrated healthcare system in the nation, and so we really see it as the VA is actually the best positioned to be able to meet the chronic disease conditions and the complex medical healthcare needs of veterans. But again, most veterans aren't eligible for the dental benefit there, and therefore we're not getting that integration. We can go to the next slide. And just want to note that, again, I'm pulling this information from some of the most recent research that we've done in partnership with CareQuest. And we're honing in on the chronic disease conditions because even after we control for factors like income and education, rurality, we see that veterans with diabetes are 40% more likely to be edentulous than veterans without diabetes. And then we can head to the next slide. We see a fairly similar number when we look at heart disease. Again, after controlling for all those other pieces, we see that veterans with heart disease are about 30% more likely to be edentulous than veterans without heart disease. So this really highlights that intersection of chronic disease and poor oral health outcomes. We can go to the next slide and talking about prevention, saving money. What we want to point out is it's not just about these very bad oral health outcomes and poor quality of life, but the potential overall health impact. We obviously know that it's oral health outcomes are not just in the mouth, they tie to that systemic health piece. So there's that piece. And then we also see that it's a very costly situation for healthcare management. So in the recent research that we've done with CareQuest, we see that if the VA would expand dental care to veterans, or if dental care can be managed in the context of an integrated healthcare environment, we see that there's a demonstrated cost savings, particularly with these two chronic disease conditions. So what our research shows us that for every dollar invested in preventative dental care for veterans, $1 is saved in diabetes care management, and $2 are saved in heart disease management. So at that point, we're really seeing that the cost put into preventative dental care is really paying for itself in the savings as it relates to chronic disease management. We can head to the next slide. And again, where are we pulling this information from? I just want to point out that these resources and reports are all available on our website, as well as vetdentaldata.org, and we can pop that link right in the chat. Yes, thanks, Sam. And as Gary highlighted at the top of this call, the data on this can be really hard to find. So we've worked really hard and put a lot of time and energy into pulling all the available data together to make it easier for folks like yourself to access it. And then doing the analysis and publishing in a way that's really easy to use. So our goal is always to ensure that we aren't doing research for research's sake. It's not sitting on a shelf. We want it out and being used in the community. So I wanted to highlight these resources. We can look at the next slide and talk a little bit about what's there as well. We're going to get started on sharing a little bit more about Missouri here and looking at what some of the available resources are. Again, on Vet Dental Data, you'll see these research articles. And this is highlighting the state profiles. We also have an interactive map on the website for those who haven't been there yet. And if you hover over the state on the map, you can find your state's profile and your report card, which we'll talk a little bit more in just a minute here. We created these for all 50 states to give you specific relevant information on what veteran oral health looks like in your state. And then we've also paired that with a veteran oral health data dashboard that should give you state-specific insights. So the goal there was to make it really interactive and allow you to look at the data in a way that makes sense to you, your work, what you're looking for, and explore the insights that matter the most. So that's an overview of what we have there. I'll dive a little bit more into the profile. We can head to the next slide and the next one. So now really getting to your state. So what are these? Oh yes, and Sam's putting a link in the profile, in the chat here, to your profile. And taking a look at what these state oral health profiles look like. What does it look like for Missouri? And a little bit about why we put these state profiles together. I encourage you to pull it up and follow it along as we go through. And really want to highlight the most relevant information, stating here at the beginning that I don't have all of the answers. AIDPH doesn't have all the answers. But again, pulling this together and then having a community discussion to see what we need to look at next. So part of what's important on these state road tours is to listen and learn from all of you, figuring out what we have and where we need to go next. See where we can upgrade resources, what improvements we can make to make sure that you have the tools that you need to be successful in supporting veteran oral health in Missouri. So ultimately, we determined that the state profiles were needed because we were getting so many questions from folks when we were talking about our national veteran oral health, about what did veteran oral health look like in their state and their local community. And so that's why we started pursuing this project and putting these profiles together. Again, also as Gary highlighted, the data are very limited, but these state profiles are a way for you to get easily accessible information that's visualized. And what we hope is that it's tangible, digestible for a variety of stakeholders, and it's easy to understand and apply. So again, whether it's pursuing funding, working on a program, or doing more of that legislative advocacy piece, that it can be used in any of those types of settings. So taking a look here, this is at the top of your the profile for Missouri. And at the very top of these state profiles is a little bit of context about what's going on in your state, and also just that national coverage of dental care through the VA. And again, just like we started on this call, we always put that at the top of our work because most people really aren't aware or understand that most veterans aren't eligible for dental care through the VA. So again, if you're approaching a policymaker, a decision maker, a grantor, a funder, you can start with the fact that most veterans aren't getting dental care through the VA, kind of just starting there. And that's why it's important to the state of Missouri, because ultimately states, other healthcare systems are the ones bearing the burden of disease and access burden and the care delivery burden because of the lack of eligibility and coverage at the federal level. And then we also went through and highlighted where veterans are positioned in your state. So if we look here and see where veterans are most concentrated in Missouri, we see that about 413,000 people in your state are veterans. And 13.1% of those folks are living in a rural county. Specifically, Pulaski, Johnson, and Carter counties are the counties in Missouri with the highest veteran population. So that is really a great way to kind of think through where you're doing your work, where you're located, where the resources in your state are located, and start to get an understanding of where the need is and how it applies to the work you're doing, and maybe partner organizations as well. And so knowing that veterans are very often concentrated in rural areas, it's really important context for state-based stakeholders to be able to make informed decisions about care delivery path, because we know that folks living in rural areas already face a disproportionate burden of disease and disability, struggling with access to care. And then we see those things also with veterans. It's again one of those intersectional pieces that really increases those barriers. We can head to the next slide. And this is pulling out some state-specific insights here, looking at Missouri versus a national comparison. And we thought that was really important information to include, because when we look at numbers, there's kind of then that so what question. If you don't have the context of what those numbers mean in a comparative way, there's not that deeper understanding of what it means. So 10%, is that good? Is that bad? We don't know. So we put this here with national context, and also like to really note that because there's a profile in the same format for every single state, if there's a state that you work closely with or has a similar demographic that is a good comparison for you, you can pull up their profile and do that same comparison with the information. If you understand what they're doing, maybe you have a partner or a colleague in another state that's doing a successful program, looking at their numbers can really give some really great context and information. And I will also say that we have found in doing these tours is that folks are really interested in what other states are doing and sharing their success stories. We're pulling that data that we've gathered on calls like this of what we've heard that's been successful in states into a report that we'll publish next year. I'm just saying that, so if you have a question about a certain state or want that information, please let us know. If you we'll have some discussion points in just a bit. So if you have a success story or pieces you want to share with other states, please be sure to get ready to share that. I think that's been one of the most important pieces to highlight, is that folks at the state level are really eager to learn what other states are doing that is successful. So again, this just gives you context if you're presenting this information. And I want to highlight here too, when we're looking kind of at these graphics across the bottom, when we're looking at edentalism, heart disease, diabetes, uninsured, 1 is being the worst and 50 is being the best. So that kind of gives you that context of where Missouri is nationally on these pieces. And the graphic all the way over to the left here is looking specifically at rural Missouri veterans and those percentage numbers. Also, if you're interested in the technical information and kind of how we got these numbers and how we did this analysis, we have all of that on the website as well if you're interested in that data piece. We can head to the next slide. So this is a report card. And again, when we were looking at these state profiles and looking to put them in a really easily digestible format, we chose to do it in a report card because most folks, that's a really quick, easy to understand format. Most of us have gone through the majority of our lives receiving report cards, and there's a collective understanding of what that means. And so there's some additional pieces on the full profile with grades there, but highlighting these pieces, and what we like to say is there's some place there for improvement with the F and the D, and C is a maybe doing okay piece. And what we like to call out is that it's important to not just look at we have an F in diabetes. That's really where we need to focus. That's really what can we do to improve there. That's certainly important, but also looking at maybe at places that have a higher grade, and or doing a little bit better and understanding the pathways to success, and really taking an analysis of like, okay, how did we do well here? What work has been done? What programs or legislation is in place that have allowed us to succeed more in this area versus this area? And then that can inform maybe some of the strategies that are put into place for the places of improvement. And I'll also say that's another place to look when you're looking at the other state profiles. Some states will have an F in one place, but an A in other places. And so really seeing what that pathway to success was for them can be helpful when thinking through of strategies and kind of understanding what to do with this report card information versus just, oh no, this is bad information. We're doing poorly. We hope that it's empowering and that it kind of highlights pathways to success versus just a bit of doom and gloom on where we are today. We can head to the next slide. So we would love for you to take a minute and pop in the chat if you were surprised about your state profile grading, and if there are data gaps that you think should be explored in Missouri. I'm also going to pause, Sam. I thought maybe I saw a question pop up in the chat. I don't know if there was anything you wanted.
Yeah, actually, Herb Silva is giving us some information for the Missouri School of Dentistry and Oral Health. Looks like they're doing free comprehensive exams leading to treatment on July 13th. And he included the phone number. So thank you, Herb, for that information. And Liz, I think you are muted right now.
I am. Thank you.
Yeah.
I'm just going along. I was just highlighting that Valerie was asking for the location. And Callie is asking about the currency of the data. So we pulled this data from publicly available information to include BRFIS and the VA, and it was published in January, I believe, or perhaps a little bit before that. Christina, I'm going to see if maybe Christina is on our comms team and she worked very closely with publishing these. So I don't know if you have a more specific answer than that.
The data was compiled by our team, I believe, throughout 2022 and into 2023, but the date of the source data is going to vary because we used BRFIS and VA and other sources. I can get you a link though, Callie, for the data background.
Yeah, that would be great. And then also I will say, as we all know, the numbers do change slightly. The eligibility numbers have actually recently changed due to the PACT Act and shifted by a couple percentage pieces. So percentage points. So that's not a huge number, but it is progress. And I like to highlight that one to share that that's an information update that we've had since we've started doing this work this January. But also that's a small movement, but change takes small pieces, small steps. And the PACT Act is an example of why conversations like this are important, why collective action is important, why community education is important. We're never going to get there in one one leap. We're going to get there in a lot of small steps. And so that's a little bit of progress. And hopefully will keep us hopeful that we'll keep going down that line. Okay, yes, and that's also, Christina, thank you. And that was what I was referencing when I was saying the technical information of how we got those numbers and the work that our research team did. And then Kim is saying that she's surprised by the percentage of veterans who receive dental services and expected it to be lower. Okay, so that's good. Okay. And not surprised on the grade. Okay, I take that as reflective of perhaps what we're seeing in our communities. Jacqueline, I'm reading, I might have missed it, the page with the state rankings, lower numbers associated with poor oral health, but would suggest that to be indicated on the page. I'm not quite sure what you're asking.
I am. It is indicated on the page. I think that was just a screenshot of the document, but if you open up the state profile, there is a note at the bottom that explains the ranking from worst to best.
Thank you.
I think that's what you were asking.
Okay, thank you for the support there. And yes, it is a screenshot. Callie is asking about the data on where the veterans, I think, are by county. And again, that we pulled all of this from publicly available information, what was available through VA, through Burfus, from a variety of public available data sources. And there's more detail of that on vetdentaldata.org. Again, that link that Christina provided with kind of the technical process. Okay. Okay. I'm going to head to our next slide, but again, please keep responding in the chat. Provide your questions there, as well as your comments and your thoughts and your insights. Okay, so again, we've talked about this a bit as I've been going through, but how are we going to use the state profile? So veteran advocacy, advocating for policy, social and clinical changes that improve access. So we've talked a little bit right at the top about how kind of improving that access through the VA requires change at the federal level. So that's obviously an advocacy piece. But there's a lot of pieces along the way that can get us there. We can do local advocacy. We can ensure that our local legislators understand through education. We can understand that our community members and our clinicians understand this. And there's small changes, even just making changes at the clinical level to include veteran status on intake forms can have a really big impact. That can be a data gathering piece that really gives us more insight about where veterans are perhaps getting care, but it also gives clinicians that understanding of who they're serving and if they have a veteran in their chair and kind of adjusting their care as needed. So we talk a lot about big P, little p. There's a lot of pieces that can be done. I know advocacy can sometimes be an intimidating word for folks, but just really want to highlight that kind of encompasses even just peer-to-peer education and sharing of this information. So again, educating stakeholders, sharing it with policymakers, program leaders, state associations, etc. We'll have a recording, so we always encourage folks to share out the recording for folks who maybe were interested in coming or heard about this late and weren't able to attend, and then they can get this piece. The state profiles are always there for your use and for sharing out. For decision making, again, informing your own work, taking a look at those maps and understanding where you work and how that relates to the work that you're doing in your community, informing your next steps, determining them, and creating a strategic direction based on this information and how that informs the programming you have. Reports and grants. So taking action, maybe you have a new program you want to implement based on this data. You're seeking funding. Again, the goal is so that this is a tool. If you're writing that grant report and need easily accessible numbers, you can just go and grab that information, easily sourceable, citable, take a little bit of capacity on the research side off, that can make your reports stronger and more compelling to get that funding for new programming. Okay. So I see, I'm going to take a look over here in the chat. Sam, is there anything you want to chime in and highlight?
Yeah, it looks like Julie's going to send a flyer for the clinic that Dr. Silva mentioned. And hopefully between Gary and the team at AIDPH, we can get that information to everyone on the webinar today.
Okay, perfect. Thank you so much. I love the community collaboration. Okay, we can head to our next slide. Okay, and we just want to highlight too, we did a project in Iowa doing a full analysis of veteran oral health in Iowa. This was really taking the state profile project and doing a full deep dive into the state, focusing on veteran oral health solutions. So this was about a year-long analysis that our research and impact team did. This report was published in January of this year. Again, we use publicly available information, and then we produce data as well through qualitative interviews with stakeholders in the state. So we did a qualitative and a quantitative analysis in Iowa and published a 74-page report looking at the state of veteran oral health in the state, and then developing out strategic recommendations based on the different types of stakeholders. I think there's somewhere between 30 to 40 individual strategic recommendations that we made for the different groups there in Iowa. We can head to the next page and look at that, those strategic recommendations a little bit. And I just highlight this because it's work that can be done if there is momentum in a state that are interested in pursuing veteran oral health and really kind of looking at, again, we're talking about, we have this basic information, what data gaps are there, what next steps need to be taken. Something like a more in-depth analysis at the state level can be done and can help inform strategic pathways for a state to take to really advance veteran oral health. There's also some really great things, again, folks wanting to hear success stories from other states. Iowa has a veteran trust fund that allows necessary financial support in addressing unmet needs while reducing high pocket out of cost for veterans. That's been a pretty successful program that looking at strengthening, expanding that, and I know several other states that we've talked to through stops like this have been really interested in that program. So highlighting just there's a lot of out-of-the-box thinking and programming that's going on across the country to address these issues. And if anyone has any questions about that, I think we're popping a link to this report in the chat. But if anyone has any questions, let us know. We're happy to answer.
And Liz, we do have a question from Valerie Jones. Yeah, and Valerie's asking, how can professionals and advocates find one another in order to collaborate and join efforts to improve veteran oral health in Missouri?
I love that. And I actually would love to hear from those of you in Missouri. I think you would probably have a better local answer than I would, not being in your state. Melissa, Gary, anyone else who wants to chime in, I invite you to answer.
So I'll start with this. So, you know, a lot of what the coalition does is advocating for policy change. We are new to this information, so this is not something that has been much of an area of focus yet. And a big reason was because we did not have the data. So we are very happy have this, and of course disappointed in our current grade of an F, and the various factors that go into that grading. So we are looking at what can be done to try and improve this for our state and for our veterans. A lot of it is starting with this data and going from that, and you know, talking to stakeholders that know more about this topic. I know on the call, I don't want to call anyone out specifically, but I know Dr. Silva has done much work with the veterans and knows this population very well. I know there are some things going on services related that the Department of Health and Senior Services is overseeing. And I know Dr. Miller is our state dental director, and Julie Beckman. They're both on here and can talk maybe a little bit about their programs. But for the advocacy part, you know, we want to get involved in that. So I would say talk to us, join us if you're not a member, and we're going to see what we can do about this. Gary, do you have anything you want to add to that?
No, I think you summed it up very, very nicely. I think, you know, what we typically do is look for leverage points around policy issues. But, you know, to get leverage, you have to build awareness. And I think awareness in Missouri about the issues that veterans are facing with oral health access and that very close relationship between that and overall physical health care is very, very low. So we would love to get a group of people together to start talking about that and build some momentum around it as a beginning step.
Thank you for chiming in, Melissa and Gary. I think that's great. And again, it seems like there's so much momentum. There's been so much interest and such good registration numbers on this event. And you both have been so wonderful to work with in setting this up. So I'm excited from Missouri that you seem to have such wonderful momentum. I will share too that at the national level, when we're doing kind of advocacy pieces around veteran oral health, and when we started our research, our approach was always to work with the VSOs and kind of go to the folks locally. I know that Melissa and I talked a bit about the local chapters of the veteran service organizations there too. So we always try to ensure that we're having that community engaged approach and kind of having that community voice part of it. I think we talk about transportation a lot. I think that really ties in. Doing veteran oral health work and rural health work, we see so many times that transportation is an issue. That varies from state to state. It could mean that snow is a problem, or it could mean that public transportation is a problem, or it can mean a variety of things based on the state. And we find that the communities themselves are always the best to answer kind of those more niche, the actual scenario behind the data that we're seeing. And I see Jacqueline has their hand raised. Jacqueline, do you want to chime in?
Yes, I was just going to say that at our level, with the state level, we're so thankful for MCOH because they can advocate on our behalf, because at the state level, we cannot advocate, we can only inform. But we do have a HRSA project going on where we are actually working with Dr. Silva and his students, and those students that are giving oral health care to veterans will actually be, we have, I think, 4 different student awards where they will actually be going towards repaying their school debt if they serve veterans. And then what we're hoping is that they have wonderful experiences, which they have had all along, and that they'll choose to help with veterans after dental school. So we're really trying to instill a public health specifically towards veterans. So that is a program we are working on within our HRSA budget. Julie, do you want to add anything?
Not really. You summed it up nicely there, Dr. Miller. Yeah, we're awarding the scholarships this year, and then they will continue. And this is a part of our HRSA grant. So we've got it for next year and then the year after that too. So we are very excited about this and working with Dr. Silva.
That's fantastic and super exciting. Thank you both for sharing that. Okay, I'm just doing a time check here. Sam, do you want to, let's see, Sarah, can you head to the next slide? And Sam, are you still not seeing slides? I'll do a check with you.
No, I can see them now.
Oh, okay, great.
Yeah.
If we can head to the next slide, Sarah, and just doing a quick check on our numbers.
And we do have another question in the chat from Valerie Johnson, if we have time. The
Yeah.
question is the UMKC Dental School doing anything similar to Dr. Silva's Veteran Day? Does anybody know the answer to that?
If I may, it's not Dr. Silva's program. It's the school's program, our dentistry in the community servicing veterans. I are a veteran. Be careful, the Marines are everywhere. Kevin, are you on? They need to know what's happening in Smiles of Hope down in the Boot Heel. But we recently I went to the new school, KCU, that's under development. They finished their first year down in Joplin and presented what we're doing with the school here is a model for other dental schools. To my knowledge, it's not happening anywhere else in the country. We are partnered with an FQHC, so their fees are significantly less than the real world. And then we go along and try and beat the bushes and get bucks from multiple sources. To date, we delivered over 1,000 arches of full and partial dentures to veterans at no cost. We've screened more than 1,100 veterans. It's part of what the students need to do as part of their education. So I say that model goes on. If you're aware of any administrators in other dental schools, happy to share the concepts with them. We get companies that want to donate material. The dental labs want to do reduced cost. The students need the procedures. Just try and put it together. I'll shut up.
Thank you so much for that. That was really helpful. There is another question in the chat from Kevin. Our Smiles of Hope Clinic has offered once monthly free extractions for veterans since 2010. Is anyone aware of funding to expand our services into restorative? Great question. Does anybody have an answer to that?
That's always the toughie, is where's the money going to come from? Nothing I can think of right offhand. The types of grants we get, typically the funders specifically exclude paying directly for services. Of course, these are funders that are interested in seeing policy and systems change like we work on, so they don't think they should use their fundings to substitute for what really should be a public health benefit that's accessible to all. So they're ultimately after that bigger systems change, and that's what we work on. And we've had some progress, but there's some significant populations that are left out.
Thank you, Gary. Thanks for chiming in. This has been a great discussion, and we have some discussion questions, some prompts. Unless somebody else has a question they want to stick in the chat, I think we'll move forward with those. Our first question is, what next steps seem viable for you or your organization to take in advancing veteran oral health? And please feel free to come on camera or answer in the chat, however you feel comfortable.
And I will say too, Sarah, we could probably stop sharing our slides, and so we can see each other better as we have a group discussion. Thanks. And I will also just, I know everyone's heard enough from me today, but I just want to highlight, when we're talking about next steps, some of the things that we talked about after our presentation were advocacy pieces, education pieces, decision making, pursuing funding with the data. Those are just some solutions or some suggestions. There certainly are other pathways to next steps, but those are some of the pieces, if that jots a thought for anyone on what's most viable to you and your organization.
Well, we primarily look at it, as I stated earlier, as a policy and systems change issue. We think the awareness has to be tapped into to pull that up first, because lack of awareness means no traction, no activity. So that's kind of the next step for us, is what can we do to ramp up the awareness of it. Working with you on this webinar, great first step, really excellent. But I don't want us to be the only answers to that question, because there's a lot of different organizations on here, and individuals, some of whom are involved in the coalition and some aren't. If you're not, I would urge you to reach out to us and get involved.
Yes, and I was going to mention, and I hate to throw another question out here, but it kind of ties in with what Gary just mentioned, and what Liz, what you had mentioned earlier about the VSOs. Is anybody on here currently in contact or any kind of connection with VSOs? Like Dr. Silva, the clinic that you all do, are you all getting any kind of direct referrals or any kind of partnership with the VSOs in the state that you're aware of?
The connection that we've made with Dr. Miller and the group in the state level has been very beneficial in expanding what what we did from beating the bushes from before. Again, getting the word out, and we've got dental students coming up and down the line. I just started 70 new students. They're going to each get 2 new veterans after our screening, and they'll get put into the system. So please submit the suggestion to any veteran to come to these things. We've had folks come from close and far away, and what Kevin has done in Southern Missouri, I don't know if you mentioned, veterans are not charged at all for the treatment that has been rendered there. Literally hundreds of thousands, if not into the 7 figures in value of treatment. And of course, to the veterans, it's priceless. But that's all acute care. That's all extractions. And then we put the puzzle, putting their smiles back together later.
Thank you.
That's great information. Does anybody else have anything to share on that topic? Anything else that seems viable for you or your organization? Oh, we have in the chat, Julie saying that the rural parish dental clinic sees uninsured patients below 200% poverty level. We can see veterans that qualify can get to the rural areas of Cadet, Bonne Terre, Bloomsdale, and Troy. That's great. Thanks for sharing that information. Thank you, Julie. And Merle's national organization, Everyone for Veterans, pairs vets with more major needs with providers similar to the DDS program. Okay. Thank you, Merle. That's great. I think we'll move on to our next question. You know, it kind of ties into some of the chat, actually. Do you have a success story, a veteran oral health policy? Anything that's worked in Missouri? Any programming that's worked or advocacy that's happening? Any success stories we can share?
Kevin, that your Kevin Armin is off. Did you have something to share, Kevin? I thought maybe.
I don't know if you can hear me.
Yeah, we can.
Oh, okay. Hi. I'm Kevin. I'm the dental minister at Smiles of Hope. We're a 501c3 in Dexter, and we're at a church, a pretty big church in our community. But we have a 10-chair practice in our clinic here, and we've collaborated with Dr. Silva in helping veterans with their dentures. We personally have supplied 127 veterans with dentures through AT Still's program, but we don't charge veterans for the services that we render. Unfortunately, all we offer currently are extractions, but I am eagerly looking into restorative care and hopefully even preventative care. You know, we live in a community. Dr. Kane is on the Missouri Dental Board. He's one of 2 dentists that we have in our city. We used to have 8 dentists in Dexter, and we're down to 2. And Dr. Kane's probably 74, 75. He's been in practice here for 44 years, maybe. So I'm fearful soon we're going to be down to 1 dentist, but there is a bright light. We're building a 33-chair dental clinic on our church property here. We've already got the parking lot done, and they're actually out back today leveling the ground to pour the concrete. for this new facility. We've taken bids from ADEC for equipment, and just really excited about our new dental clinic once it gets up and going. I know y'all got questions, so I'm here to answer.
That's really great, Kevin. Can I ask a question? How did you get funding for this, for the new 33 chair practice?
We received a $1 million grant. I don't know if it's a grant. It was put in the Missouri budget. And that's where $1 million of the $8 million came from. The other $7 million was raised here at the church.
Wow, that's really impressive. And thank you for sharing that. We are running a little bit low on time, so I don't know, Liz, should we continue on? Or this has been a great discussion, by the way. You guys get an A+ for participation. So thank you, and I'll hand it over to Liz.
If I can interject, lastly, VA had a thing that they called it the VA Smiles for Veterans program. I am a veteran. I've never knocked on the door of the VA, even though the guys I flew with in Nam, they're all 100% disabled. Having said that, the VA Smiles for Veterans program, I think they started it back east at Rutgers and NYU, where they coordinate and basically with an FQHC. But basically what they're doing is saying, hey, here's the veterans that live in this zip code. And then the veterans then are subject to the reduced fees at the FQHC type of thing, unless they can find another resource that's going to offset that. I think it's certainly at Rutgers and NYU, either they were doing that with their endowment or something. But when we looked at it and we were providing services at no cost because we were getting it from different funds type of thing. So just be aware that with going along with where your FQHCs are, maybe there's a way to identify the veterans within their geographical locations and they can put them in touch with them. That works.
And thank you so much, Herb. I'm just gonna, I know we're at time. I'll try to give us a very quick closeout. Sarah, if you are able to pull up the slides again so we can look at our next steps. I'll just say typically, we don't typically post like our chat transcript, but I think we'll see if we can share that in a document. There are so many numbers and resources and organizations that were shared amongst each other today. I want to make sure those on the call have that information. So I think we should be able to pull that into a document we can easily send to the folks here today. To make sure all of that great, rich information is captured. And again, thank you for such great engagement. It seems like this conversation could keep going, so hopefully that's good news, Melissa and Gary, that y'all can take a next step and keep the conversation going. We're happy to support and help in any way we can. We will post this recording. We'll stay in touch. CEUs are available for today's session. You need to have attended the entire session. We will post the link to get those CEUs in the chat. There is an evaluation tied to that, so those are incredibly helpful. It gives us information on how to best form these programs. So even if you aren't interested in the CEU, we encourage you to fill out the evaluation and let us know how we can improve. Again, we'll post the recordings and resources and we'll email them out as well, so everyone has them and can continue sharing with your colleagues. And all of the resources that we talked about today are on vetdentaldata.org. So without further ado, we can go to the next slide. And just to reiterate that we believe that veterans deserve equitable oral health, and we're so thrilled that all of you in Missouri are so engaged with this topic and ready to take action in your state. Again, we'll stay in touch, and I hope everyone has a wonderful rest of their day.
And I just wanted to say real quickly, thank you so much to Liz and Samantha and everyone with AIDPH for doing this work, for continuing to do this work and highlighting it. We at the Coalition are definitely interested in continuing this conversation. And I think this is a great start. And I also want to thank everyone who joined us today. Thank you so much.
Yes, thank you, Melissa. It's been a pleasure working with you, and I can't wait to continue the conversation. Take care, everyone.